Hi, my name is Lisa Schmidt, and I'm a TMJ Association board member and patient advocate. I also am a patient with hEDS and severe TMJ, and I'm in California. And I have no disclosures to declare. I have a bachelor's degree in clinical laboratory science from the University of Massachusetts. Before my TMJ surgeries, I had a career working at NASEM. I have suffered with asthma, allergy issues, and joint issues my entire life. Many times I was told my pain was from fibromyalgia and that none of my conditions were connected. I was diagnosed with hEDS by a geneticist at the age of 47. Had I known about EDS earlier in my TMJ journey, it may have led me and providers down a different path. I'm sharing my story today so other patients with EDS know what can happen with dental procedures and TMJ surgeries. We know that TMJ disorders are a complex medical condition and that TMD pain has been reported in up to 71% of Ehlers-Danlos patients. What are temporomandibular disorders? Dr. Bill Maxner performed the first and only prospective longitudinal study of temporomandibular disorders. The initial outcome of the OPERA study unequivocally that TMD is a complex disorder that envisaged with a biopsychosocial model of illness, which acknowledges the influence of genetic and environmental factors. It is a misnomer and no longer appropriate to regard TMD solely as a localized orofacial pain condition. For the majority of people with chronic TMD, the condition is a multi-system disorder with overlapping comorbidity. Okay, now my TMJ journey. It began in 1999 when the primary care physician sent me to an orthodontist to have a splint made for my migraines. The splint pushed my jaw back, causing the disc to go out of place, and I could no longer open my mouth. Next, I was sent to an oral surgeon who recommended that I have arthroscopic surgery. After this surgery failed, he suggested that we fix my bite with braces, as well as upper and lower jaw surgery. My joints rapidly degenerated, and he removed the disc. This surgery also failed, and my jaw fused to my skull. The surgeon then blamed me for the failed surgeries. That is when I became depressed and began looking for another surgeon. The second surgeon performed a bilateral total joint replacement, which required 2 revisions. After this, I had chronic pain, but the joints functioned for about 12 years. Gradually, I lost all of my hair to an autoimmune disease, possibly caused by metal sensitivity. In 2015, these joint replacements failed due to bone growth and metal sensitivity. He removed the failed TMJ implants and left me jointless. My jaw became recessed, causing me to develop severe obstructive sleep apnea. Next, I underwent a digitally planned 9.5-hour surgery to place the distraction hardware, and upper jaw surgery was also performed. I became very ill. That changed quickly. I became very ill after surgery, and I was admitted to the hospital for pneumonia, sepsis, and symptomatic anemia. I was hospitalized for 6 days. My hematocrit dropped to 20%, and I needed 2 blood transfusions. This shows the photos of the distraction osteogenesis. At this point, I was required to use a screwdriver to move the distraction hardware, and every 12 hours for 20 days. It was so painful that I could only lay there in extreme pain with tears rolling down my cheeks. In July of 2016, the surgeon told me that he brought my maxilla too low and that I required another upper jaw surgery. He also was going to move my lower jaw to meet my malformed upper jaw. He actually placed the hardware for this surgery in the orbits of my eyes. This caused excruciating pain. This was done without my knowledge, discussion, or consent. He didn't even see fit to tell me what he did after the procedure. My pain management physician found the screws there when he ordered an x-ray. One of my other physicians likened this surgeon's treatment to torture. I was his victim. Next slide. This was me after the 2016 surgery. I have now learned that the turning distraction hardware in my neck caused me to have a lifelong swallowing disorder. This is a photo of me prior to the second total joint replacement with a third surgeon, and this x-ray shows my severe anterior open bite after my failed surgeries. This is my current status. In February 2017, I had my second total joint replacement. My mandible did not come forward enough because of the position of my upper jaw. In December, we decided that a sliding GDoplasty would bring my chin forward and improve the sleep apnea. Today, I continue to deal with an anterior open bite. I also have sleep apnea, but it's managed with a BiPAP machine. I am concerned about my future overall health and particularly about future TMJ restorations. Chaos and controversy in care are due to the lack of scientific research that results in evidence-based treatment. Without evidence-based treatment guidelines for professionals to adhere to, it leaves the profession unaccountable to the problems that may arise. It is not uncommon to hear of patient abandonment or patient blame when the treatment worsens the condition. The consent process is open-ended and allows the surgeon to have free rein to make an undiscussed decision while the patient is under anesthesia. TMD patients seek treatment from a broad array of differing professionals. This is a result of the uncertainty and controversy that abounds in the field and the failure of therapies to address the pain and dysfunction that accompany this condition. I am a member of the TMJ Patient Led Roundtable. The team reviewed 24 different organizations that claim to treat TMD. Of these, the American Association of Dental Research, the Academy of Orofacial Pain, and the Association of Oral and Maxillofacial Surgeons had published information for treating TMD, but no clinical evidence-based formal guidelines had been developed. It has become obvious that we have very little science that supports even the most common treatments, such as a bite split. A multidisciplinary research and care team needs to be developed to address this complex condition. This slide shows some of the suggested specialties that could make up this multidisciplinary team. And of course, every multidisciplinary team needs a fur therapy support team. And these are all my little three babies. In March of 2020, the National Academy of Science, Engineering, and Medicine developed this report after a year-long study. Unfortunately, this did not get much press time because of the attention the COVID-19 pandemic received globally. The National Academy stated, action is urgently needed to improve care for individuals with temporomandibular disorders. Too long compartmentalized as a dental issue, both the clinical management of and research addressing TMDs needs to implement a holistic and multidisciplinary approach. Individuals with TMD symptoms often encounter health professionals across medicine and dentistry and beyond that are unfamiliar with TMDs and do not know where best to refer patients for further diagnosis and treatment. The gaps and divides between medical and dental care are vast in the United States. As a result, patients can get lost between the two systems or not receive the multidisciplinary care they need. Evidence-based clinical practice guidelines for TMD care are needed, as well as efforts to enhance accessibility to high-quality patient-centered care. Looking forward, these are some things that we are working on. We have the TMJ Patient Led Roundtable project, and this is a collaboration with the TMJ Association, patients, device manufacturers, providers, researchers, the FDA, and the NIH. And through the Patient Led Roundtable, we're in the process of developing a temporomandibular registry with the FDA. The division is MD EpiMan. And recently, the NIH announced an initiative called TMD Impact so that they could do a platform so we could have more TMJ research. So things are exciting. The TMJ Association has embarked on these initiatives. All stakeholders have come to the patient-led roundtable. We already have some successes to tout, and everyone is committed to working for the benefit of the TMJ patient. It is important we continue to push for scientific research on temporomandibular disorders so treatments will become safe and effective for all patients. This next slide is just a list of some of the things that the TMJ Association has done over the years. The TMJ Association is the only organization right now that pushes science for TMJ disorders. And I just wanted to thank you for listening and letting me share my experiences. Thank you.